Well, several public health experts, including the former director of the IDPH, were asked to testify this afternoon before a congressional subcommittee focused on the COVID-19 pandemic.
They provided suggestions on how the U.S. can better prepare for the future public health emergencies. Capitol Bureau Chief Mike Militich is live in Springfield tonight with the latest. Mike.
Daniel McKenzie, good evening. Dr. Ezike told the committee today that Illinois saw a significant increase in the COVID-19 death rates for black and brown people compared to their white counterparts. Ezike says the United States should have helped states better inform the public about how they could better protect themselves from COVID-19 early into the pandemic. The former director says many people contracted the virus because contact tracing and other efforts were implemented too slow. Ezike says tackling health inequities should also involve dealing with the baseline chronic diseases that are most common in black and brown communities.
We need flexible funding for state, territorial, and public health agencies. Special funding is also critical to keep the safety net hospitals running, and we want to partner with our public health agencies for the betterment and the creation of healthier communities.
The Select Subcommittee on the Coronavirus Crisis is also recommending that the country increases the uptake of the COVID-19 bivalent booster through a new targeted campaign. They argue that the campaign could prevent thousands of deaths and hospitalizations and save billions of dollars in medical costs. For now, reporting live in Springfield, Mike Militich, WGEM News.